Hi guys, my name's Alana. Welcome back to my YouTube channel, Mental Health with Alana. If you're new here, please click the red subscribe button and give this video a thumbs up if you like content like this. I post videos Mondays and Fridays, so make sure you turn that notification bell on so you know every time I post a video. I've also got a business where I sell sensory boxes for your mental health and for neurodivergent people. If you're interested in purchasing a box or looking at my options, I will put my Instagram up on the screen here for you to see. And if you'd like to buy one, please send me a DM over on my Instagram. For this video, I'm going to be talking about a treatment for psychiatric disorders called TMS, Transcranial Magnetic Stimulation. Now, I actually did a bit of a search on YouTube to see if there was anything about this, and there really wasn't anyone talking about their own experiences with this. So I'm going to be explaining what TMS is and briefly how it works. I'm not going to go into the massive scientific kind of thing about it, but I'm going to explain briefly how it works from my own understanding and then my experience when I had it. And I'm also going to talk about some other people's experience who I know have used it and where it may or may not have worked. So TMS is a treatment used specifically mainly for depression. It can be also used for like OCD. So TMS is basically the magnetic stimulation on the brain stimulates dopamine. So obviously if you're depressed, often you'll be put on antidepressants because they increase the amount of dopamine in your brain. TMS is kind of like having a strong antidepressant. For me, at least, that was what the effect was. So when my psychiatrist decided to do TMS, I had already been on one antidepressant, which I've been on for a long time. And I was in this was in the midst of a 6 months hospital stay. Like I had a whole year of psychosis, a lot of that, a lot of stuff going on, and I had a very bad depressive episode, and so the medication wasn't really helping. So my psychiatrist said that we could try TMS. So TMS basically, in a real basic explanation, it stimulates dopamine, and it's kind of meant to act as a faster kind of antidepressant. Because with this you can normally have about 20 sessions of TMS, or you can go up to 30, I'm pretty sure. I only did 20 because after 20 sessions, I was like really, really good. Like I reacted really well to TMS. So there are no real side effects apart from that you may get a headache. Some people did get migraines. I had a friend who was doing it at the same time and she would get horrific migraines. So unfortunately that does happen, but the doctor can give you obviously like pain medication and like migraine medication when it comes to that type of thing. And you can take Panadol before you go get it, things like that. But luckily for me, I never got any sort of headache or migraine, but that is something. Now, TMS obviously isn't for everyone. It depends on what condition you have. If the condition is something where you are depressed or you like need that increase in dopamine, and the psychiatrist thinks it would be good for you, then that's an option that they can do. Not all clinics or hospitals have this as options. So I was inpatient at the time and I would do it every morning for 5 days a week, and I'd do it in the morning, and I would just go down to the bottom level of the hospital, and they had like a room that was like the TMS room, and you would go in there each time. At the beginning of the session, before I started them, they gave me a like a DAS test, which is basically like what they give you. They kind of give it to you all the time, different things. It like marks how much anxiety and depression you have. It's like a fill out questionnaire thing, very basic. It's really only to screen for depression and anxiety. It doesn't screen for anything else. And then they also gave me a lot of other paperwork, which was all about my mood, things like that at the time, because they want to have that done so that then when you come into the end of the sessions, when you fill out the form, they can see whether the TMS did like kind of improve your symptoms and your mood. So TMS doesn't work straight away, but I'm pretty sure they said after about 4 to 5 sessions you should start noticing a difference. Now, I wanted to put this into because if you have bipolar disorder, they do have to be very careful with this treatment because like an antidepressant, it increases dopamine in the brain. When you have bipolar, you are very prone to mania, and things like antidepressants and TMS do increase the chance of you having a manic episode. So I was still allowed to do it, but with my psychiatrist, she had to be very careful and they had to really monitor me mood-wise to make sure that it wasn't triggering anything. Thankfully for me, it did not trigger mania at all, which was good. So I had 20 sessions because by the end of the 20 sessions, I was feeling so good. I'm telling you, it was amazing. I did not expect it to really do like, you know, a massive amount, but it worked so much better than antidepressants. I've been very limited when it comes to antidepressants because of my bipolar disorder, and antidepressants has triggered mania for me before in the past. But yeah, this TMS, like with medication, it can take ages to work, whereas TMS, you do 5 days in a row in 1 week and it starts working. I noticed a massive increase in my mood. I was so unwell and depressed, and it just like lifted it so much. By the end of 20 sessions, I was completely out of my depressive episode. Nothing in my life, no medication or anything had ever done anything like that for me. It was an absolute like game changer, and I was very shocked actually to how well it worked. It had no side effects, like I was saying. You might get the headache or the migraine, but it's not like with medications where, you know, you have to wait ages and then the medication might not work, and you have to switch to a different one, and then, you know, you might get this long list of side effects that are really bothering you, you know, the whole thing. This TMS was quick, it worked really well, you didn't have all the side effects, it was a lot better. The thing is, it's not going to work for everyone though. It's the same as medication. It may not work for you. For me, it did work. Now, I have a bit of a theory about this though. I don't know whether this is scientifically true, but because I do have bipolar disorder, my brain is very sensitive to anything that releases dopamine, and it really seems to kind of react to that. Because my brain is automatically wired to go into mania, so if you consider me versus somebody else who doesn't have bipolar disorder, if I start an antidepressant, it generally works quite well for me because my brain is prone to reacting to that kind of increase in dopamine. The same with TMS. I think because I do have bipolar disorder and my brain is sensitive to the increased dopamine, that's probably why it could have worked so well for me. It didn't send me into mania, but it definitely improved my mood like drastically. And I only had to do the 20 sessions because by the end I was like it was really good. So some people can't do TMS for multiple reasons. Now because I was doing it inpatient, like I said, it was done in a few weeks. You can do it outpatient, but I don't know whether insurance or healthcare would cover it. I don't know. I was at a private hospital, like mental health hospital, so I also don't know whether they do this in the public system. I don't know. TMS has been around for quite a long time now, but only maybe in the last like couple years have they started rolling it out in more areas. But a lot more people are starting to use TMS now because it's just so much more, you know, like I was saying with the whole medication thing, and you don't have to keep paying for meds and remembering to take them. It's a lot better option for people, and often you'll do it. My psychiatrist said for me, like I had that 20 rounds of it and it worked really well, and so she said to me, we might do it again in another 6 months or in another year's time just to keep up. It's like a maintenance thing, so that you kind of keep up with keeping your mood like stable and stuff like that. Did speak to a lot. I literally asked so many people because a lot of people were doing TMS when I was inpatient. So I was asking a bunch of people about how it went for them and how they were finding it. Most people said it did work, but they said that it worked, but it didn't. There was only one person I think who I spoke to who said they noticed like this humongous change. Like they were like just so much better. And then a lot of people said it really did work for them. But people didn't really seem to say it worked to the extent of it did with me. And that's why I kind of have a bit of a theory of maybe it's because I have bipolar. My brain is more susceptible to reacting to things like this. This may not be scientifically true. This is just what I think of my own experiences. But yeah, so people reckoned it really worked. Majority of people, some people it didn't. So it really depends. You don't know. It's like with medication, you don't know how you're going to react to it. But I mean, if you're offered it, it's a really great option. And like I said, even if you do have bipolar, they can do it. They just have to be very careful. Like my psychiatrist was really careful about monitoring my mood and checking that I didn't have any sort of early symptoms of mania. And the nurses also get you to fill out, like I said, like those worksheet questionnaires to gauge your mood, like quite frequently. What happens is the psychiatrist who has to be trained in TMS will do an initial like test. So what they do is you sit in a chair. It looks kind of like a almost like a dentist chair in a way. So you sit in this chair like a dentist chair, and at the beginning, to figure out where to place the magnet, I will also try to insert a video, a picture of what this is, because it's kind of hard to describe if you haven't had this done before. But basically, there's a big magnet that kind of sits down on your head like this. And for them to figure out what part of the brain to actually, like what part of your head to put it on, they do an initial test where the psychiatrist who's trained in TMS will come in and they will use the magnet. Now the magnet makes this weird noise. It kind of goes and then it goes bing, and then it goes like, so it keeps going. And how fast or how slow it is depends on the placement of where it is on your head, and also the way they figure out what strength to put the magnet at. They get you to put your arm out like this on the chair and to relax, and then they'll put it where they think it should go. Generally it kind of sits like almost like here on the head. Mine often would sit about here or here. And they normally did it on this side of my head. And what they do is they'll keep increasing the, I don't know, almost like output of the magnet. And then once your hand twitches a bit, like not that drastically, but you know, your hand will twitch a little bit. And when they get it in the right spot, that's when your arm and your hand will twitch. So then they know. Now, this is a painless treatment. It's not, I want to reiterate, this is not ECT. This is not electroconvulsive therapy. You are conscious for this. It is not painful at all. It just feels kind of like somebody is tapping on your head. And it depends on the speed of the magnet and how fast it's going. And it also depends on where they've put it on your head. They use a like measurement system. I'm not really sure how they figure this out, but they basically use like a tape measure and this other like measurement thing to figure out where to put the dot, because they have to use like a marker. It washes off your skin, but they have to like put the marker on your head where they need to put the like the magnet. So the magnet, it sits like this on on your head. So the magnet is kind of like a oval kind of shape, and it sits basically like sitting on your head. It is quite heavy, but it was okay. But like you can feel the weight of it because it's a massive magnet basically. So yeah, they lower like the magnet. Once they've figured all that initial testing out and you start having sessions, they will, each time you go in, they will like measure it up to where they have it in their records. Like they'll write it down and then they measure it up. They'll put a dot there, then they'll lower the magnet. They might test it quickly just to adjust it. The problem is that some nurses put mine a little bit too close to the front of my head, and so because it was a bit more, my eyebrow on that side would go up involuntary, so my eyebrow would keep twitching. Can't do this eyebrow. My eyebrow would keep twitching, and I mean it's not really an issue, but for me I would tell them, oh, can you put it a bit further back, because it didn't feel like it was in the right spot. But for the most part, most nurses would get it in the right spot. But obviously everyone who's doing it is going to do measurements a tiny bit differently. So these nurses were also trained in TMS. Once the psychiatrist does the initial testing, then the nurses can do it. So yeah, they place the magnet on your head and they turn it on, and it would just make this noise, and you can feel like it's like a hard tapping at your head, like if you were to do this. It doesn't hurt though, it's not painful, it's just an odd sensation, and it is quite loud. You could wear earplugs if you really wanted to, but I didn't. So it would go like dun 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 dun, and then you go bing, and then it would stop for a few seconds, and then it would go up again, dun 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 dun, bing, like that, and it keeps going over and over and over again. Now in the room that I was doing it in, there was there were 2 chairs, so often 2 people would be doing it at the same time. And honestly, it's like, apart from the thing going ding 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 and being quite loud, like it's actually, I found it quite relaxing, because you're just sitting, you know, they would dim the lights, they'd put on like this nice calming like music with all these like, I don't know, nice like waterfalls and things, like different landscapes on the screen on the TV, or they'd put music on that you wanted to listen to, and then the nurse would just be sitting there, and the nurse might have a chat to you while you're doing it as well. 20 minutes goes super quick as well, it's not long at all. So that's what TMS is. Definitely if I ever go into a bad depressive episode, I would choose that over adding an antidepressant or increasing my antidepressant, because I am on venlafaxine. But I would 100% choose TMS over meds for all of those reasons that I said. So yeah, I want to make this video because I feel like not many people are aware of it. I did briefly know what TMS was, but it wasn't as well like used until recently, because when I was in hospital last year, basically the entire hospital was doing it, which is great. I mean, it's great that they've found another thing that can help people, you know, because often with mental health it's lengthy process of them finding anything to really help, and not really much has changed in terms of treatment for illnesses. So yes, I wanted to make this to explain about what it is. If you want to know more, I will link some information down below, because I didn't want to go into a full-on scientific thing. To be honest, I don't remember if my psychiatrist fully explained it to me. She probably did, but at that time when I did do it, I was severely depressed and psychotic, so I don't really remember any of the information I was provided with at any point in that time. So yeah, but I will find some articles and I'll link it down below if you want to do some research. Obviously I'm not a doctor, so I'm just giving you this perspective from my own experience and from what it did for me. But again, reiterating, everyone reacts differently. So yeah, that was the video on TMS. I hope you guys found this interesting. And if you had TMS, comment it down below and let me know how your experience went. Because mine was a super positive one. So thank you guys for watching, and I'll see you in my next video.